like glass bone at the end of a black hole, cold, lost and upside down.
Hey Esabelle, come watch this zombie movie with me. Hey, those are just like me. The zombies? This is the belief for those with Cotard delusion. People with this delusion believe they are dead, don't exist at all, have no blood or organs, can't or don't have to eat, or in rare cases, believe they are immortal. A person may have one or more of these beliefs. Mild cases involve shame and self-resentment, while severe cases involve depression and delusions. People with Cotard syndrome often lack the ability to feel pleasure. Depending on the beauty or ugliness of their surroundings, some patients may believe they are in heaven or hell. Am I in heaven? This condition arises in schizophrenic individuals or as a reaction to some medication. Most people know what blindness is, but did you know there is such a thing as motion blindness? The term Akinetopsia refers to the inability to perceive movement. There are two types of Akinetopsia. Inconspicuous Akinetopsia is the less severe and more common of the two types. Those with this condition may see moving objects like a type of double exposure and notice residual pictures after an object has moved in their visual field. Gross Akinetopsia is more severe and can impair everyday life. Instead of seeing movement as a smooth, continuous movie, those with this second type see the world as individual frames. This makes perceiving direction and speed of motion impossible. Medication, Alzheimer's disease, and damage to the brain area known as the V5, the area that processes visual movement, are the most common causes of Akinetopsia. Hey! Who are you? What do you mean? I'm your roommate. You're not my roommate. You may look like her, but you're not my roommate. 911, there's a stranger in the house. For some, this situation is sadly familiar. Capgras syndrome occurs when parts of the brain that register emotional familiarity are damaged. People with Capgras recognize their loved ones' appearances, but they don't feel like they know them. So they often believe their friends and family to be look-alike imposters. Strangely, in some cases, Capgras sufferers may recognize a family member's voice, such as over the phone. They just may not feel familiarity seeing their loved ones. That's the last of it. Time to eat. Sweet! The eating disorder known as Pica is characterized by the persistent desire to eat non-food items and substances that contain little or no health value. Some items may even be dangerous. Cravings include a wide range of objects depending on a person's age and the attainability of the objects. Common cravings are thread, paper, cloth, paint, dirt, metal, chalk, rocks, and soap. Most with Pica still do eat regular food in addition to their favorite objects. Pica often occurs with schizophrenia, autism, or in rare cases, pregnancy. Who are you? Your roommate? Oh, you are my roommate! With prosopagnosia, people cannot recognize or recall even familiar faces. Unlike Capgras syndrome, prosopagnosia does not impair emotional familiarity, just facial recognition. In severe cases, people cannot remember faces of those they see every day, nor can they produce mental images of loved ones. Those with this condition rely on other forms of recognition like body structure, gait, hair, and voice. For obvious reasons, this condition can cause relationship problems. Hey, fancy running into you. Hi. And they also experience trouble following movie plot lines. Who was that again?